Question 1. A nurse is assessing a patient with rheumatoid arthritis, RA. Which of the following symptoms is most characteristic of RA? A. Symmetrical joint involvement. B. Asymmetrical joint involvement. C. Joint stiffness that improves with activity. D. Spontaneous joint repair. Correct answer, A. Symmetrical joint involvement. Rationale. RA typically presents with symmetrical joint involvement, meaning the same joints are affected on both sides of the body. This is a key feature distinguishing it from other types of arthritis. Question 2. A nurse is planning care for a patient with osteoarthritis. Which intervention should be included in the plan of care? A. Encourage high-impact exercises. B. Apply cold packs to affected joints. C. Promote extended periods of rest. D. Teach joint protection techniques. Correct answer. D. Teach joint protection techniques. Rationale. Joint protection techniques, such as using assistive devices and avoiding activities that strain the joints, are important for managing osteoarthritis. Cold packs can be beneficial, but joint protection is a broader and more essential strategy. Question 3. Which laboratory test result is a nurse most likely to monitor in a patient receiving methotrexate for rheumatoid arthritis? A. Complete blood count, CBC. B. Urinalysis. C. Thyroid function tests. D. Lipid profile. Correct answer. A. Complete blood count, CBC. Rationale. Methotrexate can cause bone marrow suppression, leading to changes in blood cell counts. Regular monitoring of CBC is essential to detect and manage these potential side effects. Question 4. A patient with gout is prescribed allopurinol. The nurse knows that the purpose of allopurinol is to A. Increase uric acid excretion. B. Decrease uric acid production. C. Provide analgesic relief. D. Reduce inflammation. Correct answer. B. Decrease uric acid production. Rationale. Allopurinol works by inhibiting the enzyme xanthine oxidase, which reduces the production of uric acid, thus preventing gout attacks. Question 5. Which of the following is a non-pharmacological management strategy for arthritis that the nurse should teach the patient? A. Taking over-the-counter pain relievers regularly. B. Engaging in regular, low-impact exercise. C. Increasing consumption of red meat. D. Restricting fluid intake to decrease swelling. Correct answer. B. Engaging in regular, low-impact exercise. Rationale. Low-impact exercises, such as swimming or walking, help maintain joint function and reduce arthritis symptoms without causing further joint damage. Question 6. A nurse is providing education to a patient with rheumatoid arthritis about joint protection. Which statement by the patient indicates a need for further teaching? A. I should use larger joints instead of smaller ones for tasks. B. I'll wrap my wrists before activities to prevent joint strain. C. I should perform exercises to strengthen my joint muscles. D. It's best to stay in one position for a long time to rest my joints. Correct answer. D. It's best to stay in one position for a long time to rest my joints. Rationale. Staying in one position for too long can lead to joint stiffness. It's important to balance rest and activity to maintain joint flexibility and prevent stiffness. Question 7. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who is showing signs of arthritis. Which symptom would the nurse expect to find? A. Ulnar deviation. B. Heberden's nodes. C. Butterfly rash. D. Swollen metatarsophalangeal joints. Correct answer. C. Butterfly rash. Rationale. Although SLE can cause joint symptoms similar to rheumatoid arthritis, the butterfly rash on the face is a distinctive feature of SLE. Question 8. During an assessment, a nurse notes that a patient with rheumatoid arthritis has swan neck deformity. This finding is characterized by A. Hyperextension of the proximal interphalangeal joint and flexion of the distal interphalangeal joint. B. Flexion of the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint. C. Ulnar deviation of the wrist and fingers. D. Fixed flexion deformity of the fingers. Correct answer. A. Hyperextension of the proximal interphalangeal joint and flexion of the distal interphalangeal joint. Rationale. Swan neck deformity in rheumatoid arthritis is characterized by hyperextension of the proximal interphalangeal joint and flexion of the distal interphalangeal joint, giving the finger a swan neck appearance. Question 9. A nurse is teaching a patient with osteoarthritis about dietary considerations. Which recommendation is appropriate? A. Increase intake of purine-rich foods. B. Consume a diet high in animal fats. C. Eat foods rich in omega-3 fatty acids. D. Avoid dairy products. Correct answer. C. Eat foods rich in omega-3 fatty acids. Rationale. Omega-3 fatty acids, found in fish and some plant oils, have anti-inflammatory properties that can help reduce symptoms in patients with osteoarthritis. Question 10. A patient with rheumatoid arthritis reports morning joint stiffness lasting for 1 hour. The nurse recognizes this as A. An expected finding in osteoarthritis. B. Indicative of an infection. C. A common symptom of rheumatoid arthritis. D. Unusual and requires immediate investigation. Correct answer. C. A common symptom of rheumatoid arthritis. Rationale. Morning stiffness lasting more than 30 minutes is characteristic of rheumatoid arthritis, differentiating it from osteoarthritis, where stiffness typically lasts less than 30 minutes. Question 11. A nurse is educating a patient about the management of gout. Which of the following should the nurse include in the dietary advice? A. Increase intake of shellfish and red meat. B. Avoid foods high in purines, like anchovies and liver. C. Consume more high fructose corn syrup products. D. Increase alcohol consumption, particularly beer. Correct answer. B. Avoid foods high in purines, like anchovies and liver. Rationale. Foods high in purines can increase uric acid levels, exacerbating gout. Patients are advised to avoid foods like shellfish, red meat, anchovies, and liver to help manage their condition. Question 12. The nurse is assessing a patient with suspected psoriatic arthritis. Which of the following findings would support this diagnosis? A. Bamboo spine on X-ray. B. Pitting of the nails. C. Heberden's nodes. D. Positive ANA test. Correct answer. B. Pitting of the nails. Rationale. Nail pitting is a common feature in psoriatic arthritis and can help differentiate it from other types of arthritis. Heberden's nodes are associated with osteoarthritis, and a positive ANA test is more indicative of systemic lupus erythematosus. Question 13. A nurse is teaching a patient with arthritis about the importance of exercise. Which statement by the patient indicates a need for further teaching? A. I should try to swim or walk regularly. B. I will avoid exercise to prevent pain. C. Stretching exercises can improve my flexibility. D. Low-impact exercises are beneficial for my joints. Correct answer. B. I will avoid exercise to prevent pain. Rationale. Avoiding exercise can lead to joint stiffness and muscle weakness. Regular, appropriate exercise is crucial in managing arthritis and maintaining joint health. Question 14. A patient with rheumatoid arthritis is being started on hydroxychloroquine. What is an essential aspect of nursing care for this patient? A. Monitor for signs of liver toxicity. B. Schedule regular hearing tests. C. Ensure regular ophthalmologic examinations. D. Monitor for hyperglycemia. Correct answer. C. Ensure regular ophthalmologic examinations. Rationale. Hydroxychloroquine can cause retinal toxicity, so regular eye exams are crucial to detect any changes in vision or eye health. Question 15. Which of the following is a characteristic feature of rheumatoid arthritis rather than osteoarthritis? A. Pain improves with rest. B. Bony nodules at the distal interphalangeal joints. C. Morning stiffness lasting several hours. D. Joint pain that worsens throughout the day. Correct answer. C. Morning stiffness lasting several hours. Rationale. Prolonged morning stiffness is more indicative of rheumatoid arthritis. In contrast, osteoarthritis typically presents with stiffness that improves with activity and worsens throughout the day. Question 16. A nurse is caring for a patient with an acute gout attack. Which medication would the nurse anticipate administering for acute symptom management? A. Allopurinol. B. Colchicine. C. Methotrexate. D. Cyclosporin. Correct answer. B. Colchicine. Rationale. Colchicine is often used for the acute management of gout symptoms due to its effectiveness in reducing inflammation and pain associated with gout attacks. Question 17. A patient with rheumatoid arthritis reports experiencing dry eyes and mouth. The nurse recognizes these symptoms as indicative of A. Osteoarthritis. B. Sjogren's syndrome. C. Psoriatic arthritis. D. Systemic lupus erythematosus. Correct answer. B. Sjogren's syndrome. Rationale. Sjogren's syndrome, characterized by dry eyes and mouth, is a common autoimmune condition that can occur alongside rheumatoid arthritis. Question 18. Which of the following environmental factors should a nurse educate a patient with arthritis to avoid as it can exacerbate symptoms? A. Warm showers. B. Low-impact exercise. C. Exposure to cold, damp weather. D. Consumption of omega-3 fatty acids. Correct answer. C. Exposure to cold, damp weather. Rationale. Cold and damp weather can exacerbate arthritis symptoms, causing increased pain and stiffness. Patients are often advised to keep warm and avoid cold, damp environments. Question 19. A nurse is providing education to a patient with rheumatoid arthritis about the importance of medication adherence. Which statement by the patient indicates a need for further education? A. I should take my medication even when I'm feeling well. B. I can stop taking my medication if my symptoms disappear. C. It's important to follow the prescribed medication regimen. D. Regular medication can help prevent joint damage. Correct answer. B. I can stop taking my medication if my symptoms disappear. Rationale. Rheumatoid arthritis is a chronic condition, and medication adherence is crucial even when symptoms are not present, to prevent joint damage and manage the disease effectively. Question 20. When educating a patient with osteoarthritis about joint protection, which piece of advice is appropriate for the nurse to give? A. Lift heavy objects with your fingers instead of your palms. B. Maintain a healthy weight to reduce stress on your joints. C. Increase activities that cause joint pain to strengthen the muscles. D. Avoid using assistive devices as they can weaken the muscles. Correct answer. B. Maintain a healthy weight to reduce stress on your joints. Rationale. Maintaining a healthy weight is crucial in managing osteoarthritis, as excess weight puts additional stress on weight-bearing joints, exacerbating pain and mobility issues. Question 21. A nurse is caring for a patient with advanced rheumatoid arthritis. Which assessment finding requires immediate intervention? A. Morning stiffness. B. Weight loss. C. Decreased range of motion in joints. D. Evidence of joint deformity. Correct answer. B. Weight loss. Rationale. While joint symptoms are expected in rheumatoid arthritis, unintended weight loss may indicate a more serious underlying condition, such as infection or medication side effects, and requires immediate attention. Question 22. A patient with osteoarthritis reports increased joint pain. The nurse knows that this exacerbation may be related to A. Overexertion or increased physical activity. B. Consumption of a low-purine diet. C. Use of hot compresses on the affected joints. D. Regular performance of stretching exercises. Correct answer. A. Overexertion or increased physical activity. Rationale. Overexertion or a sudden increase in physical activity can exacerbate joint pain in osteoarthritis. Patients should be advised to pace their activities and avoid overstraining their joints. Question 23. In a patient with gout, which of the following dietary changes is most appropriate to recommend? A. Increase protein intake with lean meats. B. Consume more whole grains and vegetables. C. Avoid dairy products and eggs. D. Increase intake of high fructose corn syrup. Correct answer. B. Consume more whole grains and vegetables. Rationale. A diet rich in whole grains and vegetables, with limited intake of meat and seafood, can help manage uric acid levels in patients with gout. Question 24. A nurse is educating a patient about the side effects of nonsteroidal anti-inflammatory drugs, NSAIDs, used in arthritis management. Which potential side effect should the nurse emphasize? A. Hypertension. B. Gastrointestinal bleeding. C. Hypothyroidism. D. Increased uric acid levels. Correct answer. B. Gastrointestinal bleeding. Rationale. NSAIDs, commonly used for arthritis pain relief, can cause gastrointestinal bleeding, especially with long-term use. Patients should be monitored for signs of GI distress and bleeding. Question 25. A patient with rheumatoid arthritis is being evaluated for surgical options. The nurse understands that which surgical procedure is commonly performed to restore function in affected joints. A. Arthrodesis. B. Total joint replacement. C. Laminectomy. D. Osteotomy. Correct answer. B. Total joint replacement. Rationale. Total joint replacement is a common surgical procedure for patients with severe joint damage from rheumatoid arthritis. It can significantly improve function and reduce pain in the affected joints. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.